First is schizophrenia. It is like the worst mental health issue anybody could have. Second is bipolar disorder, sometimes very severe OCD. These problems might, again I'm saying might, require lifelong medications. Many people, even in this, they feel that they start feeling better in 2 to 3 months of medication and then they stop the pills. It is wrong.
At what point, is it right for a person to take professional help? Because, like you said, sometimes you may just be feeling low, or there may be continuous, days where you feel a little low or you feel a little upset. But by watching something or by looking at something, temporarily you become okay. But after that,
Right.
again, maybe you feel low.
Right.
Or so,
Right.
at what point does
Right.
one identify, when should they go to
Right.
the mental health
Right.
professional?
Right. Right. See, I'll tell you a very interesting concept. In some countries, some European countries, everybody, each and every person has their own therapist. So even if you're not having a mental health issue, you just go to them once a month and you talk about how your month has been. Now, that I think might be wishful thinking if I think that it will happen in India in the next few years. But that should be the ideal. Let's say 20 years from now, we should keep that to be the ideal. That like everybody has their nearby kirana shop, like everybody has their nearby medical shop, like everybody has their general physician. Now you have a family doctor. Everybody should have their own psychiatrist. You go to him once every 6 months, even if you're not having an issue. Coming to the scenario wherein you're not comfortable with that, just you'll say, doctor, all of that is all good, but the country that we live in, the situation that we live in, is still so much of a taboo. So when do I go? First, as far as depression, you said, if you feel that lack of happiness or that boredom persistently for 2 weeks, then we say that you're having a major depressive episode. You must go to someone. Two, if you're feeling low throughout, you're feeling anxious throughout, you interact with people and then you become alone, again you start feeling bad, you need to go to someone. Third thing is, if you get even one suicidal thought, even once every month, and that stays only for 5 minutes, but if you get a suicidal thought, please go and seek help of a psychiatrist, because you don't know when that suicidal thought, which is once a month right now, will become once every hour. We don't want it to progress to that level, because the key is, let's say, the earlier you go to the mental health professional, the earlier he will treat you. It's like, let's say, and many people, again I'll give the heart example. Many people say that if you are having a heart attack, you need to reach the hospital within the first 90 golden minutes. If you reach within 90 minutes, that's why ambulances are given green corridors. If you reach within 90 minutes, the chances of saving the patients are very high, because damage has not been done. Similarly, if you visit the psychiatrist within the first 1 month of you having issues, any minor issues, even if he gives only therapy, even if he gives very mild medication, the chances that the brain damage is less, and therefore the duration of your medication is less, are much higher. The later you go thinking ये तो निकल जाएगा, ये तो समय है, बीत जाएगा, कभी खुशी कभी गम, this phase will go off. The more you think that way, the more you are increasing your problem, the more you are going into, it's like a chakravyu, and you are like Abhimanyu, and you are getting more and more stuck in.
A lot of people also think that once they take medication for a mental health illness, they may have to take it for the rest of their life. So they try to ward off that by doing different things, like you mentioned. Trying to look at some motivational video, or trying to do yoga, and try to ensure that they get away from professional help, so that they don't have to take they don't have to take medicines throughout their life. So what is your perspective on that? How do you?
Yeah, it's a very, very common problem. Very rightly you've put it. It's like, if I get 100 patients, 50 patients are more concerned in their first visit. They don't ask me, doctor, will I become good or not? They'll ask me, till when do I have to take this medication? So there is a lot of, I would say, irrational fear regarding this. Now there are two categories of mental health issues. One is, we say, minor mental health issues. Then is major mental health issues. Let's talk about the major mental health issues. There are only 2 to 3 illnesses which fall into this category. First is schizophrenia. It is like the worst mental health issue anybody could have. Second is bipolar disorder, sometimes very severe OCD. These problems, if OCD, if it is severe, these problems might, again I'm saying might, require lifelong medications. But the more common problems which 95% of the population faces, like sleep issues, anxiety issues, phobia, adjustment issues, depression, these problems generally you require to do a course of medications of 6 to 9 months. Many people, even in this, they feel that they start feeling better in 2 to 3 months of medication and then they stop the pills. It is wrong. If you do a 6 to 9 month course, if and during that 6 to 9 months course, if you do some sort of therapy, now here is the catch point. Many people, what they do is they start taking medicines, they start feeling better, so they just become dependent on medicines. They don't do anything else. They, once you start taking medicines, doing meditation, doing therapy, doing yoga, doing journaling, having a pet which can act as an antidepressant, then it can make wonders. But during that time when you're taking medicines, you have to develop more healthy coping mechanisms, wherein, let's say, next time your boss says something to you, what do you do so that you don't get so fearful? Next time you don't get an appraisal in your yearly appraisal meeting, rather than going into a negative spiral, what is the coping mechanism that you can have? So this is taught in therapy. If you do that while the medications are going on, 99% of the patients who have these minor problems can be weaned off medicines, of course, under the guidance of a psychiatrist in generally 6 to 9 months. Second thing is, if you're having a problem, it becomes better. Don't stop the pills. Stop them only when the psychiatrist says so. I'll give another example. Let's say we go to the general physician and he gives us antibiotics for 5 days. We are having a cough and cold. He always tells us that you have to take the antibiotic for 5 days, even if you start feeling better from 2 days, because otherwise you might get a reinfection. Similarly, what people do, similarly, what needs to be done here, even if you start feeling better in 2 3 months, take the entire course so that the chances that you have that again are very less than. It's like whatever problem was there in your brain, biochemical or whatever it was, with medication and therapy, you have tried to control it to a good level. Another example is, let's say you go to a movie, and let's say in the interval, many movies that we see, they're very predictable. In the interval itself, you know what's going to happen at the end. But do you just go off to your home after the interval because you think that you know what's going to happen at the end? You still stick around. Similarly, even if you start feeling better, do the entire course. Chances are that in majority of the people, it will not be lifelong. Chances are that if you do the course, again, you getting the same problem will be very less. And one more thing is, and I don't know from where this comes, many people who come to us, they say, कि Dr. Saab, liver, kidney kharab ho jayega ye goliyon se. Majority of the pills that are available in the market today do not affect your liver, neither do they affect your kidney. So please don't worry about that. What damage a normal antidepressant does, more damage is done by what every Mumbaikar loves so much. A vada pav, a nice oily vada pav is much more dangerous for your entire body than an antidepressant pill. And it is something that you need. It is something that is required. So rather than thinking about it as a dependence, rather than thinking about it as an addiction, think about it as a part of your meal. So when you sit down to have your meal, what I recommend to my patients is you take your thali, you have your curd, you have your dal, you have your chapati, keep the antidepressant pill in your thali. Have you ever wondered, ki, oh my God, I'm 30 years now. Have I ever wondered, I'm 30 years now. I've been eating food since 30 years. Do I have to take it for the rest of my life? I never think in that way. It is something that your body needs. Similarly, if your mind is broken, it is something that your mind needs.
Subscribe to Midday India. Get direct notifications on all our videos by clicking on the bell icon.